Okay, chapter 20, blood vessels. We're still talking about the cardiovascular system. We did blood, which is the connective tissue inside of the cardiovascular system. Then we talked about the heart, which is the pump for the cardiovascular system. And now we have the blood vessels, which are the carriers of the blood. All right, the three major types of blood vessels are arteries, capillaries, and veins. Now, there's two types of circulation. There's the pulmonary circulation, and then there's the systemic circulation. And we're mostly going to be talking about the systemic circulation, but truth be told, some of the same things are going to be told about the pulmonary circulation as well. The definition of an artery is a blood vessel that carries blood away from the heart. Now, I just want to stress that not all blood that's in an artery is oxygen-rich blood, because the pulmonary arteries are carrying oxygen-poor blood from the heart to the lungs. The capillaries, they're going to be the blood vessels that are for exchange of nutrients and wastes. So the capillaries can drop off the nutrients to the tissues and then pick up the wastes from the tissues. And then we have veins. The definition of a vein is going to be a blood vessel carrying blood back to the heart. Not all blood vessels that lead to the heart are going to be deoxygenated or oxygen poor blood. Some of the veins, like the pulmonary veins, are carrying oxygen rich blood to the heart, to the left atrium. And then we have small arteries called arterioles. There's a specific arteriole we'll talk about called a metarteriole. We find that in the capillary bed. And then the blood vessels in between sides of the capillaries and veins are called venules. So venules are small veins. For some reason, when I upload the PowerPoint to the program called Explain Everything, it doesn't show all of the lines on the pictures, or sometimes the words are all messed up on the picture. So I'm going to draw the line if it's missing. For example, the artery. The artery is going to be this vessel that is right here in the brackets. Notice how round it is compared to the other blood vessel, which is the vein. So I'm going to continue the line out here for the vein. The vein is everything that's inside of this bracket right here. The veins are collapsible, which is why it looks this way. The lumen is really narrowed because it's flattened. But the artery is pretty round. I'm going to draw a circle around in the artery right here. Okay, it's pretty round because it has a lot of elastic components to it, so it stays kind of rounder. But also, the blood that's being carried by the arteries have a higher pressure to it than the blood inside of the veins. So the lumen of a vessel is going to be where the blood is carrying or being transported, like right here I'm coloring it in. That's where the lumen is. So you notice the lumen is pretty round in the artery, and then the lumen in the vein, here it is, it's pretty flat because it is collapsible. The previous few slides told you the difference between the tissue layers of the blood vessels. There are three basic tissue levels when it comes to blood vessels. They're called tunics. The one that's on the inside that's closest to the blood that lines the lumen is called the tunica intima. It's also known as the endothelium. It's going to be a simple squamous epithelium with a basement membrane around it. This is the layer that's closest to the blood. You'll notice in the veins, some veins, the endothelium comes in and forms flaps, and they're valves. They're going to prevent the blood from flowing backwards. We find valves in the veins of the limbs, the upper limb and the lower limb. Once the blood gets into the bigger vessels like the superior and inferior vena cava, there are no more valves. All right, this middle tissue layer is called the tunica media. I'm going to draw lines to it on this one and on this one. Tunica media is muscle, and it is smooth muscle. This is the layer that's responsible for either vasoconstriction or vasodilation. Vasoconstriction is whenever the smooth muscle contracts and it narrows the lumen, so it closes the blood off. Vasodilation means the tunica media has relaxed. It opens up and allows more blood to flow through. So that's the tunica media. The tunica media layer is thicker in arteries, and it's thickest in arterioles. And then the outermost tissue layer is called the tunica externa, and is mostly a fibrous connective tissue that's on the outside. So tunica externa is the most superficial layer. Tunica media is in the middle. Tunica intima is on the inside. Now, some of the larger blood vessels, whether it's artery or it's vein, the outermost tissue layers, the tunica externa, can't get their nutrients from the blood that's traveling inside the lumen, so they have their own blood vessels. The blood vessels of blood vessels are called vasa vasorum, and they're carrying oxygenated blood to the outer layers of tissues of the blood vessels and then picking up the wastes as well. Smaller and thinner blood vessels don't need the vasovasorum because they can get their nutrients from the blood that's being carried through the lumen of the endothelium. There are two types of arteries based on their size. There are elastic arteries first. They're called elastic arteries because they have a high content of elasticity to them, and that is because it is carrying blood at a really high blood pressure. So the larger arteries are called elastic arteries. These are the largest, like the aorta and some of the major branches like the common iliacs and the carotid arteries and then the brachycephalic artery. So the bigger arteries are called elastic arteries, and they're carrying blood at a really high blood pressure. In this picture, this is showing you a microscopic picture of the tissue layers of a large elastic artery. This line points to the lumen. That's where the blood is traveling through. So that would make this layer right here the tunica intima, because that's the layer closest to the blood. This line is pointing to the elastic components that are found in the walls between the layers of the tunica media, between the muscle tissue layers. That's what's giving this elastic artery its elasticity. It's how it can expand to accommodate for the blood pressure. So the tunica media is going to be this thickest layer right here. And then the layer that's on the outside is the tunica externa. Since this is a large vessel, it also has the vasovasorum, the blood vessels in the outer layer of the blood vessel. And then we have the muscular arteries. They're also known as the distributing arteries. So they're smaller than the elastic arteries, so they're not as elastic. However, they have a really thick tunica media. They have a really thick muscle layer, so they can do vasoconstriction and vasodilation a lot easier than the elastic arteries. And these are most of the named arteries. What they mean by named is they're named by the region or the organ they're going to, like the gastric artery going to the stomach, the hepatic artery going to the liver, so on and so forth. So this is a microscopic picture of the muscular artery. Again, this line is pointing to the lumen right there. That's where the blood is being transported to. The elastic layers are concentrated at the part of the muscular wall that meets the tunica intima, and then we have an external, another elastic membrane that's closest to the tunica externa. But this whole layer right here is the tunica media, and then this layer right here, that's the tunica externa. What they're not showing you is the tunica intima. And if I wanted to show that to you, we'd have to take a closer picture. Oops. And it's going to be that right there. The smallest arteries are called arterioles. These are the blood vessels that lead to the capillary beds. So they're smaller than regular arteries, but they're bigger than capillaries, and they still have the same tunics that the arteries have. When we get to the capillaries, you'll see that there's only one tunic, which is going to be the endothelium. The diameter of the arteriole is controlled by the sympathetic nervous system. That's your fight or flight nervous system. It directs where the blood should go to your skin and muscles in your digestive system, or if it should go to your muscles in your liver if you're in a fight or flight mode. The capillaries are the smallest of the blood vessels. There's only one tunic, the tunica intima or the endothelium. These are the vessels that are used for an exchange. We're exchanging oxygen for carbon dioxide. We're dropping off nutrients and picking up wastes. As you can see in this picture here, the capillaries are only big enough to allow one red blood cell to pass at a time. There are three types of capillaries, and the first one we're going to talk about are called continuous capillaries. The continuous capillaries are the most common of all of the capillaries. We find them in skin and in skeletal muscles. There are tiny gaps in between the cells called intercellular clefts. So there are intercellular clefts that are in between the cells, and that is how the fluid leaks out of the continuous capillaries. In this picture here, we can see these gaps, these clefts in between the cells. These are the intercellular clefts right here. All right, let's label this picture. There are special cells that surround some capillaries, and they're called pericytes. The pericyte in this picture is going to be this cell right here. The more pericytes that surround a capillary bed, the less permeable the capillary is going to be. And then we have a picture of a red blood cell. That's what we're pointing to right there. Intercellular clefts. That's going to be what we're pointing to right there. The endothelial cell. That is the endothelium. It is right here. So the cleft is in between two endothelial cells. Then we have the endothelial nucleus, which is going to be the nucleus of the endothelial cell right there. We're not going to worry about pinocytic vesicles. Or the basement membrane. We won't worry about anything else that's on there. Now I want to point out that the continuous capillary is the most common, but it's also the least permeable, because the only way that fluid can leave the circulation is through the intercellular clefts. When we get to the other two types of capillaries, you'll see that there are other mechanisms that make them more permeable to fluid. And now we have fenestrated capillaries. That's the second type of capillary we're going to talk about. Fenestrated capillaries have the intercellular clefts just like they do in the continuous capillaries, but these intercellular clefts are larger. They're bigger, so it's more permeable. They also have large holes in the cell. A hole is called a fenestration. Now they also call them pores. So not only do they have large intercellular clefts, they also have large holes in the cells called fenestrations. So they are more permeable than the continuous capillaries. Let's go ahead and label this one. So we're not going to worry about the pinocytic vesicles. The red blood cell in the lumen, I'll go ahead and point to that. It is right there. Then the fenestrations, right there, the holes, the windows inside of the cell. Intercellular cleft is right there. That is the gap in between cells. Endothelial cell, I'll go ahead and point to it, and it is right there. All right, the locations of the fenestrated capillaries, they're going to be wherever there's a high exchange rate of blood, like the small intestine, so we can get in nutrients from the gut, and in the kidney, where the kidneys are making urine. We'll talk about the kidneys and fenestrated capillaries when we get to that chapter in the urinary system after this test. And now we have sinusoids. Sinusoids are the most permeable of all the capillaries. So we had continuous capillaries, which were the least permeable. Then we have fenestrated capillaries, and now we have sinusoids. And sinusoids have gigantic intercellular clefts compared to the others. They are a lot larger than they are in the fenestrated capillaries. And they have large holes inside of the cell, so there are large fenestrations. The sinusoid capillaries have to allow whole cells to pass into or out of the circulation. Let's label some of these structures. We have the endothelial cell right there. The red blood cell inside the lumen, again, is right there. Large intercellular cleft right there. The nucleus of the endothelial cell is going to be right there. So again, their claim to fame. The sinusoid capillary, they are the most permeable. So we're going to find them in organs where we need to have whole cells pass through, like the bone marrow. Blood cells are made in the bone marrow, in the red bone marrow. So we have to get those red blood cells into the circulation. Then we have the liver. That makes sense because the red blood cells, if they need to be destroyed and they are not being destroyed by the spleen, the liver can break down the red blood cells that are old and worn out. Plus, the liver also makes the plasma proteins like albumin, globulin, and fibrinogen, and those are pretty large proteins, the largest protein being albumin. And so it has to put that into the circulation as well. And then we have the spleen. The spleen is in the upper left quadrant of the abdomen, and that's where red blood cells go to be broken down after they're no longer useful. Let's talk a little bit about capillary beds first. Whenever there's a capillary bed, that means there's a whole bunch of capillaries together feeding one certain tissue or type of tissue. There's an arteriole that runs through the very center of a capillary bed. It's called the metarteriole. I'm going to try to spell it out here. Again, I'm using my finger, so it's going to look weird. Metarteriole. That is the only type of arteriole that we have to specifically know the name for. And it's in the very center of the capillary bed. And the reason why we talk about the metarteriole is because there are sphincters associated with the metarteriole, and they're called precapillary sphincters. These precapillary sphincters will control whether blood leaves the metarteriole, goes into the capillary bed, or if it's just going to go straight through to the venular side. The reason why it's going to be diverted is because you were either in the parasympathetic nervous system mode or the sympathetic nervous system mode. If you're in the parasympathetic nervous system mode, then your blood is diverted to your digestive system so that we can deliver the nutrients to the liver. If you're in the sympathetic nervous system mode, then the blood would be diverted away from the digestive system, away from the urinary system, and diverted to the heart, lungs, skeletal muscles, and the liver. This is showing you a typical capillary bed. We can see the capillaries right here. I guess maybe I should point them using the label. Right there. Whenever there's a systemic capillary bed, there's going to be an arterial end and then a venular end. The arterial end is carrying oxygen-rich and nutrient-rich blood in the systemic system. It's different in pulmonary. We're just going to focus on systemic though. So then blood goes into the capillary bed through a metarteriole. And in this book, for some reason, we're calling it a terminal arteriole. But it's also a metarteriole, and that's exactly what we call it in physiology. All right, there are precapillary sphincters associated with the metarteriole. And if they are closed, like right there, then the blood is going to be diverted away from that capillary bed. This is a better picture of the capillary bed because it's closer. And now we can see the precapillary sphincters. They show some that are open and some that are closed. So in the ones that are open, I'm going to point to them right now. Right there, you can see that the blood leaves the metarteriole and goes into the capillary bed. The ones that are closed, like in this example, there is no blood going into the capillary bed. They go straight through, passes through until it does get to an open precapillary sphincter. But if all the precapillary sphincters are closed, then it would just go ahead and go straight through to the venular side. All right, let's talk about veins and venules. Venules are the smallest of the veins. They still have the same tunics as regular arteries and regular veins, so there's 3 tunics. But the tissues, the tunics of the venules are really small and thin. They are so small that they still allow for some exchange if needed, but it's a negligible amount. It's a very, very small amount of exchange. So some oxygen can still pass through if it needs to, and some nutrients can still pass through and some waste. But 99.9% of the nutrients and gases are going to be exchanged with the capillaries. Now veins, they start with the venules. They are small, they converge, and they get larger. What I didn't mention earlier about arteries is that they diverge and they get smaller. If we're comparing the tissues and the tunics between veins and arteries, the lumens of veins are larger because the tunics are thinner. The tunica externa, though, is actually thicker in larger veins. The tunica media is thicker in the larger arteries. And veins are less elastic than arteries because they're carrying blood at a lower blood pressure compared to systemic arteries. The physics behind the flow of fluids and gases is that they must follow a pressure gradient. A pressure gradient means a change or a difference in pressure between two areas. Fluids and gases will flow naturally from a high pressure area to a low pressure area. So blood pressure, as blood leaves the systemic circuit, as it goes into the aorta, or even as it goes into the pulmonary trunk, that pressure is higher compared to everywhere else. So the highest blood pressure is at the aorta, and then as blood travels through the length of the cardiovascular system, pressure gets lower and lower. And then we get to the capillaries where we have the exchange, and then we have the veins returning back to the heart. The blood pressure in veins is really low. So there are some mechanisms in place to help the blood flow back to the heart. One way was mentioned earlier, and that's the use of valves. The valves in the limbs, the upper limbs and the lower limbs, are found in the veins, and they prevent blood from flowing backwards. So as blood passes through the veins, if it tries to go back, it closes the valves. The other method of preventing or helping blood get back into the heart is using the skeletal muscle pump. So the skeletal muscles in the limbs, as you contract and stretch the muscles on your limbs, as you flex and extend the elbow, knees, ankles, and wrists, it helps propel the blood towards the heart as well. The third method of helping blood return to the heart is using the breathing mechanism, using the diaphragm. And the way that works, and you don't have to worry about this right now, but just going right down there using the respiratory pump or a breathing mechanism. The method behind it, or the reason behind it, is that whenever you contract the diaphragm pushes down to the abdomen, which increases the volume of the thoracic cavity and lowers the pressure inside of the thoracic cavity. And then whenever the diaphragm relaxes and pushes back up into the thoracic cavity, it decreases the volume of the thoracic cavity and increases the pressure. So this whole thing of breathing in and breathing out, contracting the diaphragm and relaxing the diaphragm, is going to force fluids into the vessels of the thoracic cavity, and then it's going to force it back into the heart. This is showing you the skeletal muscle pump. So the vein is right here in the direction of the flow of blood they have with these arrows right here. So we have blood going into the veins through the limbs. This picture right there is showing whenever the venous valve is closed, as blood goes up through the vein, and then as it opens to allow blood to go through. Whenever the muscles contract, they put pressure on the outer walls of the veins, and they help milk, if you will, the blood back towards the heart. The rest of this PowerPoint talks about the different vessels of the pulmonary circulation and the systemic circulation. There's not much to the pulmonary circulation. It's just the blood vessels leading to the lungs and back. Most of it's going to be in the systemic circulation, talking about all those arteries. We're going to go over them in a minute. What I'm probably mostly going to do is just point to them with the little laser pointer, like this little light right here, and then let you label it yourself, because that'll help you remember. All right, the start of the pulmonary circulation is right here at the right ventricle. As the right ventricle contracts, it pushes blood through the pulmonary semilunar valve into the pulmonary trunk. So the pulmonary circulation starts with the pulmonary trunk. As soon as the pulmonary trunk splits, it becomes pulmonary arteries. Pulmonary arteries are carrying oxygen-poor blood to the lungs. So then the pulmonary arteries lead to pulmonary capillaries that we can see right here. And then the pulmonary capillaries, carbon dioxide is going to diffuse into the alveolus. Oxygen is going to diffuse from the alveolus and into the capillary. And then the blood's going to be returned back to the heart. It returns through the pulmonary veins. So the pulmonary veins are carrying oxygen-rich blood back to the heart and into the left atrium. So the pulmonary circulation starts with the pulmonary trunk, and it ends with the pulmonary veins. In the systemic circulation, we're going to start with the aorta. The aorta is the largest of the blood vessels. The aorta starts right here at the heart. It comes up through the ascending aorta, and then it goes around the heart through the aortic arch, and then down through the thoracic aorta. And then after it passes the diaphragm, it becomes the abdominal aorta. And there's all kinds of branches off the abdominal aorta. And then when the abdominal aorta, when it gets to the pelvis, it splits into the common iliac arteries. And then in the pelvis, it goes inside or outside the pelvis, internal iliac to external iliac, so on and so forth. So we're going to go through each one of these and label where they are and where they're going. So the very beginning of the aorta starts in the ascending aorta, which is right here. It starts with the aortic semilunar valve, which is the valve between the left ventricle and the aorta. The very first branch off the aorta is going to be the coronary arteries. The coronary arteries start right there at the aortic semilunar valve. The first organ that wants to be supplied with oxygenated blood is going to be the heart, so that the heart can keep pumping. So then the aorta crosses over in an aortic arch. So here's the aortic arch. There are 3 branches off of the aortic arch. The very first one, you have to know these in order. The very first one is called the brachiocephalic trunk. The very second branch off the aortic arch is called the left common carotid. And then the third branch is called the left subclavian. So brachiocephalic trunk, common carotid, and then left subclavian. Sub means below, clavian is the clavicle. So the subclavian goes underneath the clavicle. Arteries and veins. The systemic arteries and veins. Systemic arteries are deeper, and then the systemic veins are going to be more superficial and on top. Since we have this picture up, let's look to see what happens with the brachiocephalic trunk. The brachiocephalic trunk is called brachiocephalic because brachio means arm, cephalic means head. So it splits. It splits into the right common carotid and then the right subclavian. So the right subclavian comes from the brachiocephalic trunk. The right common carotid comes from the brachiocephalic trunk. The left common carotid comes from the aortic arch, and then the left subclavian comes from the aortic arch. As soon as the aortic arch passes or goes behind the heart, it becomes the descending aorta. The descending aorta is also known as the thoracic aorta. As long as the aorta is in the thoracic cavity, it becomes the thoracic aorta. As soon as it goes beneath the diaphragm, it becomes the abdominal aorta right here. And then the very end of the aorta is right before it goes into the pelvis, and it splits into the right and left common iliac arteries. When it comes to the arteries of the head and neck, the only one I'm going to mention and talk about is going to be the common carotid arteries. Whether it's the right common carotid or the left common carotid, the common carotid goes into the neck, right here, and then it splits. It splits into an internal carotid and an external carotid. The external carotid is going to feed oxygenated blood to the face and scalp and the facial muscles. The internal carotid is going to go inside of the cranium and through the carotid canal, and then it's going to feed blood to the brain because it goes inside the cranium. The reason why we talk about the common carotid is because of this right here, where it splits. Where it splits right here is called the carotid sinus, and that is where we have the baroreceptors, which are going to detect your blood pressure. The vertebral artery is another artery that's in the neck, but it's in a specific location. The vertebral arteries are located inside of the transverse foramen of the cervical spine. We looked at the cervical spine in the lab, and there are holes in the transverse process, and they're called transverse foramen. So the vertebral artery is a branch off of the subclavian, and then it goes up through the spine through the transverse foramen. The vertebral artery comes together at the brainstem and forms the basilar artery, and we're going to look at the basilar artery as it goes into the brain. Right here we have the vertebral artery on this side, And then we have the vertebral artery on this side. They come together at the brainstem, and they form one basilar artery. So then the basilar artery goes on front, it's on the ventral surface of the pons, and then it circles around the diencephalon. This circle around the diencephalon is called the circle of Willis. So you have to know the vertebral artery, which leads to the basilar artery. And then you need to know the basilar artery leads to the circle of Willis. The circle of Willis is important because it goes around the diencephalon. We can see where there's another entry right here and right here. This other entry point into the circle of Willis is called the internal carotid. So the internal carotid that we looked at coming up through the neck goes into the brain right here into the circle of Willis. If there's any type of blockage in one side of the circle of Willis, then the blood can go around it, going around the circle. All right, now we're going to focus on the systemic arteries and going into the upper limb. All right, so this is the brachycephalic trunk right here, the first branch off the aortic arch, and then it splits. The subclavian artery goes underneath the clavicle. Once the subclavian artery reaches the armpit, it becomes the axillary artery. So right here's the axillary artery, and then continue down. As soon as it gets into the arm, it gets past the humeral head, it becomes the brachial artery. So here's the brachial artery. This is the artery that they're going to close off with a blood pressure cuff whenever they're measuring your blood pressure. The brachial artery, once it gets to the elbow, it splits in the forearm. It splits into a radial artery. The radial artery is on the lateral side. It's on the thumb side. It's in front of the radius. And then we have the ulnar artery. Ulnar artery is on the medial side of the forearm. And then they come together in the palm to form the palmar arch right here. Let's do that again. We'll start with the subclavian. So subclavian artery becomes the axillary artery in the armpit. Then it becomes the brachial artery in the arm. Remember, the arm is from the shoulder to the elbow. And then when it gets to the forearm, it splits into a radial artery, which is lateral forearm. Then an ulnar artery, which is medial forearm. And then the palmar arch, which is in the palm of the hand. This slide talks about the different branches off of the abdominal aorta. As soon as the aorta passes through the diaphragm, it becomes the abdominal aorta, and it gives rise to many different branches. So we're going to go through these and talk about what they are supplying with the oxygenated blood. We're not worried about the inferior phrenic arteries. We'll start with the celiac trunk. The celiac trunk has three immediate branches. There's the hepatic artery. Hepatic means liver. So the hepatic artery, which is a part of the celiac trunk, it goes to the liver. Then we have the left gastric. We're just going to say gastric, but it's also known as the left gastric artery. It is going to the stomach, because gastric means stomach. And then we have the splenic artery. And the splenic artery is going to the spleen, which makes sense, which is in the upper left quadrant, but it's also going to the pancreas. So the splenic artery is to the pancreas and the spleen. So pancreas and spleen, splenic artery. Stomach, gastric artery. Liver, hepatic artery, and they're all a part of the celiac trunk. And then we have the superior mesenteric artery. The superior mesenteric artery is going to the small intestine and the proximal half of the large intestine. So proximal half large intestine. Mostly is being supplied oxygenated blood from the superior mesenteric artery. Then there are the suprarenal arteries. Supra means above. Renal means the kidneys. So suprarenal is going to something that's above the kidneys. And what is above the kidneys? That's right, the adrenal glands. So the adrenal glands are above the kidneys, is bringing oxygenated blood from the suprarenal arteries. Well, then that brings us to the renal arteries. Renal means kidney. So the renal arteries are going to the kidneys. And then we have the gonadal artery. The gonadal artery is going to, guess where? The gonads. Well, what's a gonad? The gonads are your primary sex organs. Well, what's a primary sex organ? Those are the organs that are producing the gametes, producing the egg cells and the sperm cells. So the gonadal artery is bringing oxygenated blood either to the testes or to the ovaries, depending whether you're male or female. All right, we already had the superior mesenteric artery. Now we have the inferior mesenteric artery. The inferior mesenteric artery is going to the distal half of the large intestine. The proximal half is getting oxygenated blood from the superior mesenteric artery. And then the abdominal aorta ends at the common iliac arteries. Let's go ahead and label some of these. So the diaphragm is that muscle that's right there. The diaphragm splits the abdominal cavity from the thoracic cavity. And then we have the celiac trunk. Celiac trunk is going to be that right there when there's three branches off of the celiac trunk. We have the hepatic, then we have the gastric, and then we have the splenic. All right, and then the renal artery. Renal artery is going to be right there. It's going to the kidneys. Suprarenal artery is going to be right there. It's going to the adrenal gland, which is that triangular pyramid-shaped organ on top of the kidneys. Superior mesenteric artery, it is right there. I need to quit making sound effects. And then the gonadal artery, it's going to be that vessel that's going down along the back end of the posterior wall of the abdominal cavity until it gets to the ovaries or the testes. The inferior mesenteric artery, which is the last branch off the abdominal aorta before it becomes the common iliac artery. This is a better picture showing you the celiac trunk. So the hepatic artery is going to the liver, and it's right there. And then the splenic artery going to the spleen and the pancreas is going to be right there. And then we have the gastric artery, and it's right there. This is showing you what happens to the aorta as it travels through the pelvis. So the aorta, right here, splits, becomes the common iliac artery. So here's the common iliac artery. Then it splits into an internal iliac going inside the pelvis. The external iliac then goes around the pelvic brim, continues down through the thigh to become the femoral artery right here. So let's draw lines to them. So the aorta is right there. Common iliac artery, right there. Internal iliac artery, right there. And then external iliac artery, right there. All right, let's trace the path of the aorta. Let's trace the path of the systemic artery, starting with the aorta, and then we'll end in the foot. So here's the aorta, and here's the common iliac artery. We'll continue down the external iliac artery, and then once we get past the femoral head, it becomes the femoral artery. So the femoral artery is in the thigh. So the thigh artery, if I ask you that is going to be the femoral artery. And then when we get to the knee, it splits. There's a part that goes behind the knees called the popliteal artery. And then some of it is going to go in front of the tibia called the anterior tibial artery. So the anterior tibial artery goes in front of the tibia, and then it passes through the ankle and becomes the dorsal pedis artery, which is right here. You should be able to feel a pulse in the dorsal pedis artery. And those people unfortunate enough to be in an accident bad enough to break their pelvis, they have to test to make sure they can still feel the pulse in the dorsal pedis artery. If they can't feel the pulse in the dorsal pedis artery, then that means there's some sort of blood vessel damage in the limb, and it could lead to internal bleeding and permanent damage. This is showing you what happens when it goes behind the knee. So here's the popliteal artery, and then the part that doesn't go to the front to become the anterior tibial, it continues down, is the posterior tibial artery. And then when it gets to the very bottom of the foot, this is called the sole of the foot. So this is going to be the plantar arch. Plantar surface is the bottom of the foot. It's the sole of the foot. So this is the plantar arch. So we have popliteal, posterior tibial, plantar arch. All right, now we're going to focus on the systemic veins before we get to the fetal circulation. So most of the veins have a counterpart which is going to be in the arteries. The veins are going to be more superficial. When we get to the limbs, though, there are some deep veins and superficial veins. The deep veins are going to lie right next to the same arteries we talked about. For example, there's a brachial artery, there's also a brachial vein right next to it, which is a deep vein. But then there are superficial veins in the limbs. So we're going to focus on superficial limbs of the veins and some other veins that don't have a match in the systemic artery system. All right, so the three major veins that lead to the right atrium, we've talked about this many times: the superior vena cava, inferior vena cava, and the coronary sinus. And then there's some unusual veins. There's the dural venous sinus system. We talked about this in chapter 13 when we looked at the brain, and we talked about the dura mater that surrounds the brain. The dura mater is split into a fibrous layer, or a periosteal layer, and a meningeal layer. And at some point, they do split and form a sinus called the dural venous sinus. The dural sinus returns cerebrospinal fluid back into the circulation. And then we have the hepatic portal system. We'll look at that later. But the hepatic portal system is a series of veins that's carrying oxygen-poor but nutrient-rich blood. It's picked up all the nutrients from the intestines and the stomach and anywhere else we're absorbing nutrients, and brings it into the liver to be processed. This picture is just showing you the dural sinus. So the dura mater is going to be this tissue layer right here. It goes into the longitudinal fissure. It separates the right and left cerebral hemispheres. It lies right on top of the corpus callosum right there. Where it splits, there's a series of veins called the dural sinus. And the dural sinus is going to drain blood from the brain, but it also drains cerebrospinal fluid from the subarachnoid space, and then it carries it down into the jugular vein. When it comes to the veins of the neck, there are no carotid veins. We had carotid arteries, but there are no carotid veins. There are jugular veins, and the jugular veins are more superficial than the carotid arteries. So there's going to be an internal jugular vein and an external jugular vein. The internal jugular vein is coming from inside of the cranium. So the blood that's being drained from the brain is going through the internal jugular vein, and then all of the blood from the face and the scalp emptying through the external jugular vein. Now when it comes to veins, they converge, so they are tributaries, which means they lead to larger vessels. So in other words, the external and the internal jugular veins are tributaries to the subclavian vein because they come together to form part of the subclavian vein. All right, this picture shows you the veins, the external jugular vein right here going into the subclavian. And then here's the internal jugular vein joining with the subclavian. So the external jugular actually joins subclavian sooner than the internal jugular vein right here. But they do come together with this subclavian vein to form the brachiocephalic vein. When we look at the veins of the upper and the lower limbs, we're going to focus on the superficial veins, those that we can actually see through the surface of the skin. And the superficial veins of the upper limb actually go through the entire limb. It starts at the wrist, goes all the way past the elbow and into the armpit. The one that is right here, that is on the thumb side, which is on the lateral side, this is the cephalic vein. So the cephalic vein starts right here, goes up the wrist, it goes past to the elbow, past the brachium. So this is cephalic, and then it forms the subclavian vein. So the cephalic vein is a tributary to the subclavian vein. All right, now let's go on the medial side, on the pinky side, right here. This is called the basilic vein. So the basilic vein starts here at the wrist, goes all the way up, goes past the elbow, goes past the brachium, and then it joins with the brachial vein to form the axillary vein right here. Now there's a vein that's different, and there's no artery that matches it, which is this one right here, called the median cubital vein. The median cubital vein is like a bridge between the cephalic vein and the basilic vein. Whenever they need to draw blood for a blood test, they'll apply a tourniquet around the arm. It will completely close off these veins, and then this vein, the median cubital vein, should pop out, and they're able to insert a needle to draw some of your blood. Okay, the hepatic portal system. A portal system, when it comes to capillaries, means that there are two capillary beds in series with each other. So one capillary series leads to another capillary series before it returns to the circulation. So we'll talk about the hepatic portal system. The other portal system that we've already talked about was way back in the endocrine chapter, way before our break in chapter 17. We had the hypophyseal portal system, and that was bringing the releasing and the inhibiting hormones from the hypothalamus to the anterior pituitary. All right, so hepatic portal system. Hepatic means liver. These are bringing nutrients to the liver. So there are two capillary beds because this is a portal system. The first capillary bed is from the digestive organs, from the stomach and the intestines. And then the second capillary bed is going to be in the liver. The liver processes the nutrients coming from the stomach and intestines. It takes the amino acids and it makes proteins. It takes glucose and it stores it as glycogen. And it takes fat and it stores it as triglycerides. So this picture shows you the hepatic portal system. So the first capillary bed it goes through is the capillary bed at the at the intestine to pick up the nutrients. And then it goes through the hepatic portal vein. And then it leads into the liver, and it's going to drop off the nutrients. And then it leaves through the hepatic vein. So there are different tributaries of the hepatic portal vein. You have to know those tributaries. So the tributaries of the hepatic portal system include the superior mesenteric vein, the splenic vein, the inferior mesenteric vein, and then the gastric vein. All four of these are tributaries to the hepatic portal vein. Well, what does that mean? That means all four of these become the hepatic portal vein. And the hepatic portal vein, that's what enters the liver. Blood leaves the liver through the hepatic vein. So the hepatic vein is not a part of the hepatic portal system, so don't mix that up. All right, the superficial veins of the lower limb. There are two superficial veins of the lower limb. There's one called the great saphenous vein, and the other one's called the small saphenous vein. The small saphenous vein is the lateral leg. The leg is from the ankle to the knee. So this is the small saphenous vein, that's where it stops. The great saphenous vein starts down here at the foot, goes past the ankle. This is medial leg. Then it passes through the medial knee, and it passes through medial thigh, comes all the way up here, and where it joins with the other thigh veins to form the external iliac vein, eventually. All right, the great saphenous vein's claim to fame is that whenever there's a bypass procedure in the heart, and you do a bypass whenever there's a blockage in the coronary arteries. A blockage in the coronary arteries is depriving heart muscle of oxygen, which causes pain and can actually kill part of the muscle tissue. That's a heart attack. That's a myocardial infarction. So they will take a small piece of the great saphenous vein and insert it so that the blood will go around the blockage. The last section of the PowerPoint talks about the fetal circulation. The fetal circulation and then the circulation of the blood vessels after birth are real similar except for three major differences. Three major differences is bypassing the lungs and also having a direct shunt into the liver to process nutrients. There are three major differences between fetal and adult circulation, and we're going to go over them. We're talking about what they look like before birth and what they look like after birth. We have to bypass the lungs, and then we also have to have a direct line into the liver. Whenever the egg has been fertilized and it travels through the fallopian tubes and implants itself into the wall of the endometrium of the uterus, a placenta is formed. The placenta, they call it a pancake-shaped organ. And that is where the fetal circulation comes into real close proximity to the maternal circulation. Now, the mother's blood and the baby's blood do not mix until birth. After birth, whenever the baby's been born and then the placenta has been separated from the uterus, then the blood types will mix. But anyway, so we have blood vessels leading to the placenta and then blood vessels going into the fetus. The blood vessels going into the fetus go through the umbilical cord. So the vessels of the umbilical cord are called umbilical vessels. Now we have two umbilical arteries and one umbilical vein. The arteries and veins are named according to the direction of the flow of blood to the fetal heart. So this red vessel that starts at the placenta and this red vessel that goes all the way in through the umbilicus, this is the umbilical vein. So this is a vein and it is colored red, just like the pulmonary veins in the lungs. It's called a vein because it's bringing blood towards the heart, and it's oxygen-rich blood because it picked up the oxygen from the maternal blood right here at the placenta. So again, we'll start the placenta. The umbilical vein is bringing the nutrient-rich and the oxygen-rich blood in through the umbilicus, through the navel. And then when we get to the liver, there is a shunt. There's a part that goes directly into the liver, and this is called the ductus venosus. Let me highlight that. Right there. Ductus venosus. That is the shunt that goes straight from the umbilical vein into the liver to process the nutrients. And then we continue on. The umbilical vein, it ends at the inferior vena cava. So now the blood coming in from the inferior vena cava into the right atrium is also oxygen-rich blood. Now the nutrients, some of them have been dropped off the liver, but there are some nutrients that will continue down. All right, so the heart is beating. We need to bypass the lungs. The blood does not have to go to the lungs because it's not breathing yet until after birth. So there's a hole between the right and left atrium. This hole is called the foramen ovale. Right there. So foramen means hole, ovale because I guess it's oval. But they're showing it to you right here. So blood goes straight from the right atrium into the left atrium. It doesn't need to go into the right ventricle. However, the blood is coming through at a pretty high clip, so some of it goes into the left atrium to the foramen ovale, but some of it still goes into the right ventricle. And then when it leaves the right ventricle, it goes into the pulmonary trunk. So here is where the third difference is. And the third shunt that goes from the pulmonary trunk into the aortic arch is called the ductus arteriosus. So ductus arteriosus is a shunt that goes from the pulmonary trunk into the aortic arch. All right, so now after the aortic arch, then blood goes through the aorta, and then it goes into the common iliacs. And then when it goes into the internal iliac, there's a branch that goes off the internal iliac, and this is the umbilical artery. So there are two umbilical arteries because you have two internal iliac arteries. All right, so here are the umbilical arteries, and they're bringing blood back to the placenta. All right, and they go through the umbilicus, and they go through the umbilical cord, and then back to the placenta to pick up the oxygen, and then back through the umbilical vein. So the three shunts that we have the ductus venosus, foramen ovale, and then the ductus arteriosus. After birth, This is all going to be fixed and it's going to look more like the adult circulation. So on this chart, it tells you what happens after birth, what happens to the ductus venosus, and what happens to the ductus arteriosus, and what happens to the foramen ovale. So the foramen ovale heals up, so there's no longer a hole. That's what they're showing right there. So there's no longer a hole between the right and left atrium. It separates the heart into a right and left side again. So after that, it heals up and becomes a depression called the fossa ovalis. And then we have the ductus arteriosus. The ductus arteriosus was the shunt from the pulmonary trunk into the aorta. Well, the ductus arteriosus closes off and it becomes a ligament known as the ligamentum arteriosum. We saw this on the lab models of the heart. There's a little piece of white tissue between the pulmonary trunk and the aorta. That would be the ligamentum arteriosum. It used to be the ductus arteriosus. Now the ductus venosus will close off and it becomes a ligament inside of the liver called the ligamentum venosum. I forgot to mention one thing, that's about the foramen ovale. The foramen ovale typically heals up after a couple of days after birth, but it's not uncommon to take up to a year, and it should be okay. If it's still a year later, they still have that hole between the right and left sides of the atrium, they will have to go ahead and do surgery. Okay, looks like I am done with chapter 20 on the blood vessels. Next, I'll do the lymphatic system. I'll have that up and running before this weekend. And then also we'll do the respiratory system before this weekend. Email me if you have any questions.